with this little introducer, put it through the instrument channel, and then when it comes out the other end of the colonoscope, 6 feet away, the tip turns around, and the camera that's on the tip looks backward. There's a light there that looks backward, and now you have 2 looks at the colon, one from the forward viewing colonoscope and one from the retrograde viewing third eye. We have a demonstration and training center here in Sunnyvale where doctors can come to learn how to do the procedure. And after they've worked with the colon model and Randy, the mannequin here, we can go out to their site and work with them and their actual patients during procedures.
Here at the Palo Alto Medical Foundation Surgery Center, we've been using new technologies to improve the rate of finding colon polyps, which can turn into colon cancer. One of the examples of this new technology is a third eye retroscope. In a standard colonoscopy, we use a high-definition camera attached to a tip of a colonoscope that's then used to examine the entire large intestine. I have a 2-foot model of a colon over here. We'll insert this camera inside this model of the colon, and we'll take a look to see what it looks like. As a part of a standard colonoscopy, the scope is inserted to the very top part of the large intestine and is slowly pulled back, examining the folds of the large intestine. Here the folds are coming into view. On this examination, looks pretty clean. We're not able to identify any polyps with the standard colonoscopy. For performing a third eye colonoscopy, a third eye catheter is inserted through the biopsy channel of the colonoscope. Here we can see the third eye catheter coming out of the tip of the scope. As it comes out, the camera bounces backwards, and this provides us with 2 views, scope looking forwards and the third eye camera looking backwards. Once you reach the end of the large intestine, the third eye camera is inserted through the colonoscope. Here you can see it coming through the biopsy channel. It's flipping backwards, providing us with 2 different views. On the left-hand side, we have a standard forward view, and on the right-hand side, we have the backwards or retrograde view of the large intestine. The colon is made up of these house-style folds, and the third eye gives us a chance to see the back part of the folds, which you can't examine very well with the standard forward-viewing colonoscopy. Here in this example, you can identify a polyp, a small tiny polyp in the back part of a fold, which you could not see with the standard colonoscopy. The physicians at Palo Alto Medical Foundation participated in an international cooperative efficacy study looking at the value of third eye in identifying colon polyps. In this large study, about 13% more colon polyps were identified with the use of a third eye instrument, and these polyps would have been missed by a standard colonoscopy.
Colon cancer is most common in people over the age of 50, and that's why they have the somewhat arbitrary cutoff point of age 50 as the point where you should start getting screening colonoscopies about every 10 years in general if you've never had anything there and you never had any symptoms suggesting a problem. But if they find anything on a colonoscopy, if you have a polyp, for example, then you should come back more frequently for repeat checks called surveillance colonoscopy to look for anything else that might have grown in the interim. That's one of the areas we think has the most promise for the third eye because you know the patient is somebody who can form polyps. There's a good chance there could be one hiding behind one of those folds. So it's worth looking there. And right now, the only way to look there is to use a third eye.
El Camino Hospital is an independent, nonprofit community hospital located in Mountain View, in the heart of Silicon Valley. Like the area it serves, El Camino Hospital has always enjoyed a strong reputation for innovation and leadership in medical technology. This commitment is clearly evident in the world-class care available through the Cancer Center at El Camino Hospital. Here, having access to comprehensive care and the latest advancements is crucial for patients facing a diagnosis of colon or rectal cancer.
El Camino Hospital is terrific for high acuity patients because of the quality of all the different aspects of care. We have high quality nursing staff, high quality technology, and high quality doctors, as well as ancillary services that are superior to many hospitals I've practiced at. If there's a complication, let's say, during the procedure, it's very important to have support staff that understand how to manage the complications. It's important to have a team of trained professionals who are available at the drop of a hat, if need be, to help support the patient in a situation where things may not go exactly as planned. So it's important to have a very diverse and well-trained team around you as much as it is to have a doctor that's well-trained.
El Camino Hospital is one of only a handful of facilities in the state that can offer endoscopy